So now let's talk about some of the common, most frequently asked questions by patients about bariatric surgery and weight loss. The answer to that is no. Most people that have bariatric surgery have long-term sustainable weight loss. So is it true that some people regain some of the weight? Yes. We're talking that close to 50% of patients who had bariatric surgery may gain approximately 5% of that weight loss. But picture in mind this, the weight loss in the patients is not just a number. Is a change in the quality of life, is an improvement of problems and comorbidities, is resolution of problems like diabetes. So the weight loss should not be just gauged on the scale. It should be gauged on the quality of life and how those things affect the patient. So the quick answer to that question is no. Most patients after bariatric surgery maintain and achieve long-term sustainable weight loss. What we've seen over the years is that people that live with obesity are more prone to develop other problems that can decrease the life expectancy. For example, a patient who has a body mass index of 40, it is expected to live approximately 7 years less than a person who is normal weight. A person that has a BMI, body mass index, above 55, the life expectancy may be shortened by as much as 14 years. And that is because of all of the problems that come with obesity, including diabetes, heart disease, increased risk of cancer in multiple places. So obesity is a disease, and as such, it needs to be treated appropriately. What we've seen is that patients that get weight loss surgery and satisfactory weight loss on the long term are patients that increase the life expectancy by as much as 40% compared to patients that live with obesity. That is a big jump. And the result of that is because most of the problems that are associated with obesity resolve after bariatric surgery. And the answer to that question is not really. And I'll explain to you why. The most commonly performed procedures today are the sleeve gastrectomy and the gastric bypass procedures. They are both extremely safe operations with very good long-term results. The chances of any complications happening from the surgery overall being less than 5%, and most of the times the patient requires only 1 to 2 day hospital stay. Both procedures are not considered malabsorptive per se, but it is truly recommended for the patient to adhere to a lifelong vitamin intake, because now your portions are small. You may not be ingesting the amount of nutrients that you may require, and because of that, you may require supplementation. But when we do have a patient that adheres to the diet that they require and then ingest the nutrients necessarily, including vitamin supplementation, they will never be deficient on those vitamins or vital nutrients. The absorption of proteins is maintained, the stamina is maintained, liver function, and most of the levels will be just normal when the patients adhere to the dietary guidelines. So in a summary to the question is no. So typically we have to look at weight loss from the initial weight that the patient presents with. The procedure also affects the amount of weight that you can lose. For example, typical patient with after sleeve gastrectomy would have anywhere between 80 to 120 pounds of weight loss after 1 year. Whereas in a gastric bypass, we may be looking at about 100 to 150 pounds of weight loss at 1 year. So in a summary, the weight loss between a sleeve gastrectomy and gastric bypass is quite comparable, but it all depends on the individual patient. So what we've seen is that the chances that you gain a lot of weight back, it only happens in about 10 to 15% of the cases. So most patients are able to lose weight and maintain it over time. It is normal for some patients after bariatric surgery to regain some of the weight back. But what we've seen is that a small amount of weight is by no means like before or life-threatening. We also see that those patients still have a better quality of life, has fewer medical problems and weight less than before? The answer is as early as possible. One of the main things and most common things we hear from our patients is that they say, I regret to not have done it earlier. Why would you wait to get treatment of obesity when the disease has gotten out of control? If you compare it to other medical conditions such as cancer, heart attacks, you want to address those issues when you have the power and the will to control them. So why wouldn't you do the same with obesity? Obesity is a disease, and it's a disease that has treatment, and it's a safe, effective, durable, and efficacious treatment that is also life-saving. So patients who are treated early for obesity have better outcomes than the patients that wait too late in the process. So when we have a patient who is very complicated, has a lot of medical problems, is very sick, it will have slightly less benefits than the patients that address the weight problems early on. When we look at remissions of diabetes, when we look at remissions of high blood pressure or sleep apnea, all of those conditions are better and have better results when they're treated early on. So don't wait.